If your current diabetes medicine, along with diet and exercise, isn't helping to lower your A1c, it might be time for a change. Let's learn now. Oh, my fellow aging friend, it seems we are both reaching that point where our bodies require a little more attention than they used to. And let's be real, sometimes our old methods just don't cut it anymore. Now, teaming up with Sanofi, this video actually for those living with type 2 diabetes, that's you. I have prepared 4 simple takeaways. Now, I have heard the diabetes struggles you have shared, from gaining better glycemic control to lowering your A1c levels, and all of this against the unforgiving context of our bodies changing as we grow older. Our old tricks not working anymore. Now, when we were younger, eating minimal carbs and exercising used to be the golden ticket to keep sugars under control. But now it is as if our bodies have wisened up and are no longer amused by our tricks. When you have diabetes, your body has a hard time, even harder as we age, right? Well, storing sugar in your cells is hard sometimes, which means too much sugar in your blood. When this happens, sometimes lifestyle changes aren't enough, and this doesn't mean you have failed or anything, but it just means that combining diet and exercise with the right diabetes medicine can do the trick and can be better for you sometimes to control your blood sugars and A1c on time. That is because age and metabolism may cause your diabetes to change over time. But don't fret, my lovely friends, I have a few tips up on my sleeve to share with you today. So grab a seat and let's laugh our way through this whole aging thing together. And let's work on to get your A1c levels under control. You'll be glad that you have watched this video today. Well, looks like we have a type 2 diabetes manager in the house. Welcome to the world of diabetes medicine and management. And don't worry, it is not all bad news at all. In fact, with a little bit of effort, you can help manage your diabetes. How, you say? Well, takeaway number 1. I'll say incorporating a 2-in-1 A1c lowering medicine. I'm introducing you today to Soliqua 100/33 because it's 2-in-1 medicine, right? It's a daily injection that works throughout the day to help control blood sugar spikes and lower your A1c. Soliqua 100/33 is like a dynamic, daring duo of diabetes medicine. It mixes a GLP-1 and basal insulin to give you 2 effective medicine at once. Now, I know some of you might be thinking, but hey, Dr. Ergin, I hate the thought of these needles, man. And to that, I say join the club. But diabetes medicine like Soliqua can be an actually important tool in diabetes medicine for those with type 2 diabetes because it works 5 ways. Get informed, folks. With Soliqua, not only is the injection once daily, but the medicine works 5 ways to help control your blood sugar levels. So the injection is just a pinch. That is definitely worth it. Here's how Soliqua works 5 ways. Number 1, Soliqua can help to reduce your blood sugar in your bloodstream by making it easier for your body to store the sugar in your cells. That includes your muscles, your liver, your fat, etc. Number 2, diabetes can make it harder for your body to store the sugar, right? You already know that. Well, Soliqua works in your liver to, first of all, store sugar for future use. Hopefully that will help you, give you the energy when you're ready to exercise for the day, right? And also, it helps slow down the process by which your liver releases the sugar back into your blood, which, if that happens, your blood sugar will be high, but with the help of Soliqua, it can reduce the morning highs that most of you are concerned about. Now, number 3, Soliqua will slow down the process of your stomach releasing the sugar. This means that you consistently have lower amounts of sugar in your blood and less spikes, right? Number 4, Soliqua helps your pancreas make more insulin. With type 2 diabetes, your body doesn't make enough natural insulin or may not be using it as efficiently as it should. Well, the downside is higher blood sugar levels. Your body can use Soliqua to properly store the blood sugar. Remember, insulin is not your enemy. Your enemy is forcing your body to make more and more and more insulin, or having to take more and more insulin because of unhealthy eating and lack of exercise. But I'm sure you're not doing that, right? But if you're not really making enough insulin and your blood sugar goes up anyway with your lifestyle changes, you gotta do something to get the job done. Number 5, Soliqua helps your muscles store the sugar that your body does not need right away. The upside is the sugar that is stored can be used as energy by your muscles. I told you this medicine provides an effective deal for you. Something very important to note are the adverse events. In the pivotal clinical trials for Soliqua, the most common adverse events encountered were nausea, nasopharyngitis, headache, diarrhea, vomiting, and upper respiratory tract infection. Serious life-threatening effects may occur, including pancreatitis, liver, and gallbladder problems. The most common adverse event with this type of medication is hypoglycemia, which is low blood sugar. Now that we have broken down that combination therapy, the Soliqua, let's talk about real-life scenarios that really brings its benefits to life. Now, how does Soliqua help you in travel season? Well, with the travel season coming up, whether for vacation or holidays, trust me, I know how hard it can be to fit in this smart eating and adequate exercise and all that stuff. And you're trying to manage your blood sugar in the middle of all that. Traveling and festivities are one of the most exciting experiences anyone can have. But for example, this summer, my wife and I are going to Italy. Well, I'm very excited about that. And with this, there are plenty of food options that can interrupt, if I was diabetic, my blood sugar management, for example. I often get questions about medicines and how to manage diabetes while traveling or during the holiday seasons when our normal schedules are interrupted, right? A lot of people, when they don't ask the question or when they don't follow the advice, end up coming back with a lot higher A1c and they just blame the holidays. Well, no more. So how can we enjoy what travel and celebrations have to offer when managing type 2 diabetes? Well, these important questions and many more are really critical for your diabetes management continuously, so you can keep your A1c under control at all times. An important takeaway is to do homework and talk to your doctor. Now, what is the homework? There are many resources that provide details on medicines and how to speak to your doctor. For example, Soliqua provides information and resources on a patient-focused website. So just check this link here, and you can also look at the description as well for the link. And you can learn more about this 2-in-1 medicine called Soliqua. And you can even talk to your doctor and how to talk to your doctor and if it is the right medicine for you or not, right? I would say don't forget to check out the patient resources because they're very important. One of the reasons I'm highlighting Soliqua 100/33 today is because they're helpful patient resources and information. You don't really want to miss out on this information, right? So go ahead, pass it on. Last takeaway is about diabetes medicine accessibility, which has been a huge problem so far. Have you been feeling like your wallet is on a crash diet? Well, it's time to beef up those savings because if you have commercial insurance and a prescription from your doctor, you may be able to get Soliqua for only $9. And if you are a Medicare patient, No need to worry about getting stuck in the donut hole. Not anymore, because as of this year, Soliqua will be covered. So say goodbye to those high co-pays that you cannot afford. Let's raise a syringe to affordable healthcare. Well, guess what? You made it to the end of this video. Congratulations, my friend. You have earned yourself a little chuckle. Now, don't forget to check out the Soliqua 100/33 website at www.soliqua100-33.com. So Soliqua100-33.com, and ask your doctor for more information. I'm not saying this medication will be right for everyone, but it's good for you to learn, to raise the question to your doctor and see if you guys agree that if you are not failing, but if you are doing everything and it's still not working, see if that medication can support you, especially during the travel season. And let's be real, you should probably ask your doctor for more information anyway, because they are the experts, right? But seriously, I really thank you for watching. You are the real MVPs. I'll see you later.